Hi, good morning. This is Kavita Kundra, and we are here to discuss IGNOU MSCDFSM Physiology Gastrointestinal System. So here the gastrointestinal system is referred as a digestive system. So you know digestive system, its another name is gastrointestinal system. So food is needed for the growth and repair of tissue, we all know. And as food passes through GIT, the tract, it gets broken by some physical factors and enzyme, and it get absorbed. And food get utilized in the body. The unabsorbed materials, neither digested nor absorbed, will get excreted from the body as feces. We all know that. So what exactly the description of GIT tract? If we see, there are different organs that are involved in GIT. So first one is mouth, from where you get the food. Then pharynx, esophagus, stomach, small intestine, large intestine, rectum, and anus. So every organ of the digestive system has its own function, and as a system they have general structural plan. So what exactly is the plan? The general structural plan of GIT is, the wall of GIT consists of 4 layers of the tissue. These are adventitia, or the outer covering, muscle layer, submucous, mucous membrane lining. Little explanation of all. So first one is, in the thorax the outer covering is made up of loose fibrous tissue, and abdomen the organs are covered by peritoneum. It is the largest serous membrane of the body. Next one is muscular layer. This layer consists of 2 layers, one of smooth muscle, and outer layer is longitudinal, and inner one is circular layer. And in between the nerves, mesenteric plexus. So it consists of parasympathetic and sympathetic nerves. Both nerves are present here. Submucous layer. This layer consists of loose areolar connective tissue, and they are lymph vessels, plexus of blood, and nerves. Mucous membrane. This layer is lined up by epithelial cells. We know epithelial cells, where we have the outer covering of our skin. We have the epithelial cells, and have 3 functions. What are the functions? Protective. Yes, it protects the internal organs. Then secretory, it secretes digestive juices. And absorptive, it absorbs. Right. Part of the tract which are subject to mechanical injury, the layer has supply of both parasympathetic and sympathetic nerves. Accessory organs which help in digestion. What are the organs other than GIT? So GIT receives various secretions. Some are secreted through the glands in the lining membrane of the organ, that is gastric juice from the glands of the stomach. And the stomach secretion, and some secretions are received by accessory organs, the other organs that are not the directly the not part of GIT directly, right? It is located outside the tract. So these secretions are received by the ducts. They are 3 pairs of salivary gland, pancreas, liver, gallbladder, and biliary tract. The next one is mouth. What is mouth? Mouth, it is a cavity bounded by muscles. We have in mouth what? Muscles and bones. So it is a cavity, hole-like structure. It is bounded by muscle and bones. So mucous layer of the mouth consists of stratified squamous epithelium containing glands. So you need to remember that the mucous layer of the mouth consists of stratified squamous epithelial cells or glands. On the upper side of the mouth is bound by the palate. Palate is divided into anterior part called hard palate and posterior part called soft palate. What are the functions? The mouth contains tongue and teeth, we all know, and that take part in mastication, the chewing, deglutition or swallowing, and thus help in digestion. Tongue. What is tongue? Tongue is a muscular organ. It has muscle, it doesn't have bone. It is covered with mucous membrane. It is attached to the hard bone by its base. The covering is called frenulum. The superior surface is covered by stratified squamous epithelium. with little projections called papillae. So what are papillae? Papillae are the taste buds. Papillae contain taste buds. These taste buds are of three types. Circumvallate papillae. These are the largest papillae, about 8 to 12 in number. They are arranged in V shape, fungiform papillae and filiform. So these papillae are of three types. So these are the four, and taste buds are, how many taste buds are there? The basic taste are sweet, sour, bitter and salty. So bitter substances are taste on the back of the tongue, sour in the edges of the tongue, sweet and salty are appreciated at the tip of the tongue. So wherever the tip having sweet and salty taste buds, sour is the edges, the kinara, okay, of the tongue, and the back you having the bitter taste. The tongue plays an important role in mastication or chewing, deglutition or swallowing, and in speech. It is the organ of speech and taste. Teeth. We all know teeth. How many types of teeth are there? Two types. One is temporary and one is permanent. Where the teeth are placed in lower jaw. Lower jaw is called mandible, and upper jaw is called maxillae. So teeth are placed in mandible and maxillae. Mandible is lower jaw, maxillae is upper jaw. Each person has how many types of teeth? Two sets of teeth. First one is temporary. Temporary are how many? 20 in number. Permanent are how many? 32 in number. Temporary teeth begin to erupt when a child is about 6 months to 1 year. After 6 years of age, they begin to fall. During 6th year of age, permanent teeth begin to replace the temporary. In 6th year, permanent teeth are 32 in number. Structure of the teeth, it includes dentine, pulp, blood vessels, nerves embedded in bony jaw. Above gum line, the tooth is protected by enamel. The tooth consists of crown. Crown protrudes from the gum. The root embedded in the bone. Neck, constricted part where crown merge with the root. Pulp cavity, it contains blood vessel, lymph vessel and nerves. Dentine hard surface, the main part of tooth. Enamel, the thin layer of hard surface or substance. The cement that covers the root of the tooth and fix it in a socket. Then the incisors and canines are cutting teeth and are used for biting of the food. Premolar and molar teeth are used for chewing of food. What are salivary glands? These are the accessory glands of digestion. They secrete saliva that reaches from ducts to mouth. There are three pairs of salivary glands. Parotid glands, one pair. Duct of Stenson. Submandibular gland, duct of Watson's. Sublingual gland, duct of Rivinus. Structure. They are compound racemose, grape-like structure. The gland cells are of two types, serous. They are made up of zymogen. Secretion is watery, rich in enzyme, poor in solid. Mucus cells, they contain mucigen granules. It is thick, contain mucus. What are the compositions of saliva? So saliva is composed of salivary glands and mucus secreting gland of oral cavity. It is cloudy, slightly acidic. It has 99.5% of water, 0.5% of solid. Solid contains 0.2 inorganic and 0.3 organic salts, enzymes, urea and citrate. So what are the inorganic salts? Let's say sodium chloride and KCl, etc. So what are the functions of saliva? Function of saliva, first one, lubrication of food. So it lubricates the food in the mouth for proper bolus formation. Digestion of food, salivary amylase. We know that enzymes are present in saliva. What are they? Salivary amylase. They act on the cooked starch and change into maltose. The action doesn't complete here because it continues in stomach until the bolus is made. pH of saliva is between 6.2 and 7.5. Cleansing properties, saliva maintains proper hygiene of the mouth and in fever. So during fever, when saliva secretion is reduced, there is a bacteria multiplication that causes the tooth decay. So here, taste. It stimulates the taste buds and enhances the taste. Articulation, it helps in smooth delivery of speech. Bacteriolytic action, it contains lysozyme, it destroys cell wall of bacteria. The control of salivary action, it occurs in two ways, unconditional and conditional reflux. Unconditioned reflux is due to the presence of object in mouth. Conditioned one is due to the sight, smell, even the thought of appetizing food result in salivation. Pharynx, it is divided into three parts: nasopharynx, oropharynx, laryngopharynx. The food passes from the mouth to oropharynx and then to laryngopharynx before entering into the esophagus. Structure of esophagus. There are four layers of tissue in esophagus: elastic fibrous tissue, that is covering the outer part; muscular layer consisting circular and outer longitudinal muscle fiber; voluntary muscle in upper portion, in the middle of the both voluntary and involuntary, and smooth in lower portion. The submucous layer consists of tissue, blood vessel, lymph vessel, and nerves. What are the functions of esophagus? It acts as a passage helping the food to pass from the pharynx to stomach by peristalsis movements. The food then enters into the stomach. And the stomach is J-shaped, situated in abdominal cavity between esophagus and small intestine. The opening by which the esophagus communicate with the stomach is called cardiac orifice. The stomach opens its duodenum through pyloric orifice. So this is a very important. Cardiac orifice and pyloric orifice is very important, and whenever you are attempting an exam, so kindly underline these parts. The capacity of average human stomach is how much? 1.12 to 1.70 liters. What is the structure of stomach? It has two curvatures, lesser and greater curvature. The lesser curvature is short, lies in the posterior kind of a back side of the stomach. It is a continuation of posterior part of esophagus, and greater curvature is on the anterior surface of the stomach. So the stomach is divided into three parts: fundus, body, pylorus. What is fundus? The part of the stomach and left of cardiac orifice is called fundus. What is body? The main part of the body is stomach. And pylorus, the lower part that curves to the right, is pylorus. So here you can see in the picture. And pyloric orifice, what is that? It communicates with the duodenum. So here we stop and we finish the stomach here, and we'll come up with another one soon. So wait for that and prepare well for your examinations. Thank you so much. Take care. Bye bye.